If you gave me a choice between getting diabetes or becoming HIV positive, I would choose HIV every.
You know, I have been sent this video a couple times. Jason sent it to me yesterday, and I thought that I would talk about it because having to choose between HIV and diabetes. This is Johan Harry that's talking about this. He's a journalist. I think he's out of the UK. But I'm going to tell you a little bit of background. From the time I was 1, I've known diabetes. My brother was 5 years old when he got diagnosed. My father got it when he was, it was the adult onset type 1. He got it when he was, I think, 39 years old. And I can't think of a worse disease. I really cannot think of a worse disease. It eats you from the inside out. And a lot of you may think this is a drastic statement, choosing between HIV, and you would choose HIV over diabetes. But it's true, because you can take medication for HIV, all the progression that we've made through the years. And I know in my era of coming up, STDs and HIV was the scariest thing. So to compare this now and really puts it in perspective to say, hey, this is how bad diabetes is. But my brother lost his eyesight. He got congestive heart failure. He lost both of his legs, amputated at the age of 28 years old, and he died at 33. And did he take the best care of himself? No, he could have done a lot better. But he wasn't given a choice. He was sick with type 1 diabetes. It was in his genetics, and he had no choice. But those of you that do have a choice, let me back up. My father, so watching my brother go through the absolute worst death I've ever seen, my father followed in his steps, W amputee, end up dying of complications of cancer. But the same scenario, eyesight, fluid, complications from other things that are coming in from diabetes because it's autoimmune. And then you die, right? And both of them were smokers, and they weren't the most active people. But I see all these type 2 diabetics that are coming into my office that can control it. And not only that, but do you realize if you are pre-diabetic or type 2, you are constantly feeding cancer cells. So it's not even the diabetes I worry about so much. It's the fact that you and I are going to have a conversation. If you're a patient of mine, you and I would have a conversation within a couple of years that you have cancer, because all those blood sugars that were left uncontrolled that caused you to have type 2 diabetes, not only is it damaging your kidneys, your eyesight, causing neuropathy, and you're losing you're going to lose your limbs. But not just that, you're going to end up with a cancer diagnosis, just like my father did. And it can be controlled. And I just want to emphasize that. Like, you have a choice, and every choice that you make right now can add years to your life. And not just years, but quality of life. That's what we all want, right? Quality of life. So think about it. If you had to choose between HIV and diabetes, what would you choose? And if you had control of it, what would you do today to start making those changes?